In our videos thus far, we have talked about medications that help put patients to sleep, cause unconsciousness. We've also talked about medications that take away patients' pain or help prevent or decrease a patient's pain. And now we're going to talk about a new type of medications and drug class that is very important in the world of anesthesia. So right here, this is our triangle of anesthesia. We have amnesia, analgesia, and then now we have akinesis. So part of our jobs is to help facilitate the surgeons, that the surgeons are able to carry out their surgery. We want to make sure that patients do not move. There are multiple ways that we can do that. We can give medications and volatile anesthetics, volatile agents that keep the patient under anesthesia and keep them asleep. But sometimes they require a little bit more muscle relaxation in order to help the surgeons and in order to help us. So we give muscle relaxants to help with the surgery. So to help the surgeons essentially be able to work where they want to work. And then we also give muscle relaxation to help us or assist us in intubating and airway management. Sometimes the vocal cords will spasm or will move or will contract or constrict. Giving muscle relaxants helps open that up and facilitates an easier intubation. So before we get into the drugs, we'll talk about just some basic physiology. And we'll start off by answering a question: how does skeletal muscle contraction occur? This is an important physiological point that we need to answer because it'll effectively explain exactly how our drugs work in future videos. So how does skeletal muscles, I should say skeletal muscle contraction, work? And let's first start off by, let's draw this hand here. So this is going to be our example. If we want a patient to move their thumb, or if we want somebody to move their thumb, if we want us to move our own thumbs, how do we get that? How does that action of moving the thumb occur? So let's start off by drawing the neuromuscular junction. So we have an axon here, axon, and then we have a muscle here. I'll draw a muscle. And this whole system is, we're going to term it, or we're going to name it, the neuromuscular junction, this area right over here. The space between the axon and the muscle. This is our neuromuscular junction, or you can think of this entire term as your motor end plate. So what your motor end plate is going to do, it's going to send signals or molecules, what have you, signals to the muscles, and that is going to cause excitation of the muscles and eventually leading to muscle contraction. How is it going to do that? So we're going into the mechanism of how muscle contraction occurs. So essentially, calcium enters the axon, and that causes these vesicles that are carrying a very specific, very important type of neurotransmitter to release their contents into the neuromuscular junction. Once released, these specific neurotransmitters will bind to receptors at the muscle, which will effectively open up these channels and allow for entrance of positive cations such as sodium to enter the muscle. That causes a propagation of an action potential, causing the release of calcium from the sarcoplasmic reticulum into the cytoplasm. So this is the sarcoplasmic reticulum. And from there, the calcium will bind to troponin, tropomyosin, that whole system, actin and myosin, and will lead to contraction. Now, we talked about this very specific, very important neurotransmitter. That neurotransmitter is called acetylcholine. Acetylcholine. That is what gets released from the axon, dumped into the neuromuscular junction, and that is what binds to these nicotinic acetylcholine receptors in order to open those channels and allow the positive cations to go into the muscle, propagating the action potential. So what we're going to do is we're just going to blow this picture up right over here, and we are going to draw the acetylcholine receptor. So I like to draw it just like this here. So I'm going to label it NACHR, nicotinic acetylcholine receptor. And what acetylcholine is going to do is it is going to bind to two sites on the acetylcholine receptor. That causes an opening of this channel, allowing the positive cation to flow through into the muscle. The sites at which acetylcholine, these two sites at which acetylcholine bind to, are the alpha subunits. And the acetylcholine receptor, the nicotinic acetylcholine receptor, will only open if both subunits are bound, in this case by the acetylcholine molecules. Right, so let's go over the mechanism of action of how a skeletal muscle contraction, or how skeletal muscles actually contract. So essentially you have this stimulating signal, your brain sends signals down the spinal cord which get to peripheral nerves of positive action potentials, eventually reaching this neuromuscular junction, this motor end plate here, where the final axon ends up releasing acetylcholine molecules into the neuromuscular junction with the help of an influx of calcium. And these acetylcholine molecules will bind to the alpha subunits, thereby opening the nicotinic acetylcholine receptors, allowing sodium to drive itself into the muscle cell, and thereby causing a positive electrical potential, increasing or propagating an action potential, which causes a release of calcium from the sarcoplasmic reticulum into the cytoplasm. And from that point, the calcium further on down the line causes actin and myosin to bind and contraction of a muscle to occur.